public health authorities continue to monitor the persistent threat of hantavirus, a rare but potentially fatal respiratory disease that often begins with symptoms as common as a standard seasonal flu. The primary concern for medical professionals and surveillance agencies is the specific environmental context in which transmission occurs. While many viral threats are transmitted through person-to-person contact, hantavirus is fundamentally an environmental hazard, closely linked to the presence of infected rodents and the disturbance of their nesting sites. This report examines the critical window of time between initial exposure and the onset of severe symptoms, particularly focusing on the risks associated with cleaning enclosed, long-dormant spaces such as garages, sheds, and cabins. In North America, the most prominent strain is the Sin-Monombre virus, which leads to Hantavirus Pulmonary Syndrome, or HPS. The mechanism of infection is often invisible to the naked eye. When rodent droppings, urine, or nesting materials are disturbed, especially through sweeping or vacuuming, the virus becomes aerosolized. These microscopic particles can then be inhaled by anyone in the vicinity. For the average property owner performing seasonal maintenance, the danger is often unrecognized until the virus has already begun its incubation period, which typically lasts between 1 and 8 weeks. The narrative of hantavirus reporting frequently highlights a specific progression, a period of relative health followed by sudden intense muscle aches, particularly in the large muscle groups such as the thighs, hips, and back. Public health officials emphasize that while these aches might be dismissed as physical exhaustion from manual labor, they represent the early inflammatory response of the body to a viral load that is preparing to attack the pulmonary system. Understanding why this matters is a matter of survival statistics. HPS has a high mortality rate, often cited by the Centers for Disease Control and Prevention as being around 38%. Because there is no specific cure, vaccine, or specialized antiviral treatment for hantavirus infection, the medical response relies entirely on early recognition and intensive supportive care. This framing is essential for viewers to understand. The time for intervention is not when breathing becomes difficult, but rather at the very first sign of these characteristic muscle aches following potential exposure in a rodent-infested environment. Neutral background data indicates that while cases are sporadic, they are geographically diverse, appearing in various rural and semi-rural settings where human habitation overlaps with rodent territories. This intersection of biology and domestic activity creates a unique public health challenge that requires constant vigilance from both local health departments and the public at large. The development of a hantavirus case involves a complex interaction between field surveillance, clinical diagnostics, and hospital-based intensive care. Once a patient presents with the early prodromal symptoms, fever, chills, and the aforementioned severe muscle aches, the diagnostic challenge begins. Because these symptoms mirror many other viral illnesses, laboratories play a pivotal role in the official reporting process. Confirmatory testing for hantavirus typically involves serologic testing to detect IgM and IgG antibodies, or the use of polymerase chain reaction, known as PCR, to identify the viral RNA in clinical specimens. Public health agencies like the CDC and state-level health departments maintain strict protocols for reporting these cases to ensure that clusters can be identified and that the public can be alerted if a specific geographic area shows an increase in viral activity among the local rodent population. In the clinical setting, the transition from the early phase to the critical phase of HPS can be shockingly rapid. Medical reports indicate that once the respiratory phase begins, the lungs begin to fill with fluid, a condition known as pulmonary edema, caused by the virus increasing the permeability of the capillaries. This is why the window for treatment is so narrow. Once the patient reaches the point of respiratory distress, they often require immediate intubation and mechanical ventilation. Contrast this with claims often seen in less formal reporting. While the virus is devastating, it is not a fast-acting poison in the traditional sense, but rather a biological process that reaches a tipping point. Verified data shows that patients who receive early intensive care in a hospital setting have a significantly better prognosis than those who wait until the respiratory symptoms are advanced. surveillance also extends beyond the human population. Biologists and public health workers frequently conduct trap and release studies to monitor the prevalence of the virus within deer mice and other carrier species. This data allows agencies to issue travel or safety advisories for specific park regions or agricultural zones. Shipping and logistics sectors also monitor these developments, particularly in facilities where long-term storage might attract rodent populations. The consensus among global health organizations is that while the number of cases remains low compared to other infectious diseases, the severity of the illness necessitates a high level of institutional preparedness. Lab capacities must be maintained to provide rapid results, as a delay of even 24 hours in diagnosis can alter the clinical outcome for a patient already entering the pulmonary stage. Prevention and public guidance remain the most effective tools in the arsenal against hantavirus, as the limits of modern medicine are reached quickly once the infection takes hold. Health agencies worldwide have established a set of standardized protocols for cleaning areas where rodents may have been present, and the core of this guidance is the absolute avoidance of creating dust. Instead of sweeping or vacuuming, which can launch viral particles into the air, experts advise the use of a disinfectant or a bleach solution to thoroughly wet any contaminated areas. By saturating droppings and nesting materials, the virus is effectively trapped in the liquid and can be safely wiped up with paper towels or rags. Personal protective equipment, including gloves and, in some cases, high-efficiency particulate air or HEPA-filtered masks, is recommended for those working in high-risk environments. Surveillance programs emphasize that rodent control in and around the home is a primary defense. This involves sealing even the smallest entries into buildings, keeping food in tightly sealed containers, and reducing clutter that could provide nesting sites. Despite these clear guidelines, there remain significant unknowns in the study of hantavirus. For instance, researchers are still investigating why certain individuals develop more severe cases than others, and why the viral load in rodent populations fluctuates so dramatically from year to year. Climate patterns, such as rainfall increases that lead to more abundant food for mice, are often correlated with subsequent spikes in human cases, yet predicting these outbreaks with total accuracy remains an ongoing scientific challenge. The public is encouraged to remain calm but informed. Hantavirus is not a common ailment, and the risk to the general population remains statistically low if proper precautions are taken. The focus of health reporting continues to be on education, ensuring that if a person does experience unusual muscle aches and fever after a weekend of cleaning a garage or a basement, they mention that specific exposure to their healthcare provider immediately. This transparency and communication between the public and the medical community is the most reliable way to bridge the gap between exposure and life-saving intervention. As we continue to track these developments and the efforts of global health labs, we invite you to stay informed on this and other public health concerns by subscribing to our channel for detailed reports. The clinical progression of hantavirus infection represents one of the most aggressive challenges in modern virology, moving from non-specific symptoms to critical respiratory failure with high velocity. Once the virus enters the human host, typically via the inhalation of aerosolized excreta from the Paromyscus genus of rodents, it targets the endothelial cells that line the blood vessels. Unlike many other viral pathogens that cause direct tissue destruction, hantavirus triggers a profound immune response that leads to systemic capillary leak syndrome. Public health laboratories and clinical researchers monitor this phase closely, as it marks the transition from the prodromal period to the cardiopulmonary stage. In the laboratory setting, diagnostic confirmation is a multi-step process. Because the early symptoms, fever, chills, and myalgia, overlap significantly with influenza, COVID-19, and other respiratory illnesses, physicians must rely on specific serologic testing. These tests look for the presence of hantavirus-specific IgM antibodies, which indicate a recent infection or a significant rise in IgG antibody titers. In more advanced diagnostic facilities, reverse transcription polymerase chain reaction, or RT-PCR, is utilized to detect the viral RNA directly from blood or tissue samples. However, because the virus is often cleared from the blood shortly after the onset of symptoms, timing is a critical factor for accurate lab results. State and federal health agencies, such as the Centers for Disease Control and Prevention, maintain a surveillance network to track these cases, ensuring that any localized cluster is met with an immediate environmental assessment. In the hospital environment, the management of Hantavirus Pulmonary Syndrome is strictly supportive. Medical records from historical outbreaks indicate that once the cardiopulmonary phase begins, the patient's condition can deteriorate in a matter of hours. The capillary leak causes the lungs to fill with fluid, leading to severe hypoxia and shock. For this reason, official protocols emphasize the necessity of early transfer to intensive care units capable of providing advanced respiratory support, including mechanical ventilation and, in some extreme cases, extracorporeal membrane oxygenation, or ECMO. While there have been clinical trials involving antiviral medications like ribavirin, they have not yet demonstrated a clear benefit for treating the pulmonary stage of the disease, leaving clinicians to focus on fluid management and oxygenation. The logistical burden of hantavirus is also felt in the laboratory, as handling the live virus requires Biosafety Level 3 containment facilities. This limits the number of labs capable of performing primary research or high-level diagnostic work, creating a centralized reporting structure. Public health officials also monitor the seroprevalence in rodent populations, the percentage of mice in a given area carrying the virus, to predict potential hot zones. This data is contrasted against reported human cases to determine if the virus is becoming more prevalent or if human encroachment into rural areas is simply increasing the frequency of contact. While the headline suggests one has only moments to act, the medical reality is a window of approximately 24 to 48 hours from the onset of respiratory distress where intervention is most effective. The divergence between sensationalist claims and clinical data is a point of constant clarification for health spokespeople, who stress that while the virus is lethal, the path to survival is paved by rapid institutional response rather than panic. This rigorous reporting and lab-based vigilance form the backbone of the global response to a pathogen that remains rare but exceptionally dangerous. The primary defense against hantavirus is a rigorous adherence to environmental hygiene protocols that prioritize the suppression of dust and the neutralization of viral particles before they can be inhaled. Public health agencies, including the Centers for Disease Control and Prevention and the World Health Organization, have established standardized guidelines for the safe remediation of rodent-infested areas, emphasizing that the most dangerous action a person can take is to disturb dried droppings or nesting materials with a broom or a vacuum cleaner. Such actions launch the virus into the air in a concentrated aerosol form, which is the most efficient route of human infection. Instead, the mandated procedure is the wet cleaning method. This involves saturating any contaminated surfaces with a disinfectant, most commonly a solution consisting of 1 part chlorine bleach to 9 parts water. For this process to be effective, the solution must remain in contact with the biological material for at least 5 minutes to ensure the viral envelope completely denatured and inactivated. Only after the soaking period should the material be wiped up using paper towels or rags, which must then be sealed in plastic bags and disposed of in a secure outdoor trash receptacle. During this process, individuals are advised to wear non-porous gloves and, in areas with heavy infestation, high-efficiency respirators to further mitigate the risk of accidental inhalation. Beyond immediate cleanup, long-term prevention focuses on comprehensive rodent-proofing of domestic and occupational structures. Surveillance data indicates that human-rodent contact is most frequent in buildings that offer easy access to food and shelter. Officials recommend a seal-up, trap-up, clean-up strategy. This includes sealing any holes or gaps larger than 1/4 of an inch, roughly the size of a pencil, using materials that rodents cannot chew through, such as heavy-duty hardware cloth, metal flashing, or steel wool mixed with caulking. In the surrounding environment, it is critical to eliminate nesting sites by moving wood piles at least 20 feet away from the home, keeping grass mowed short, and ensuring that all pet food and household trash are kept in tightly sealed, chew-proof containers. These practical steps are considered the most effective way to lower the local viral load and reduce the statistical probability of a spillover event from the rodent population to the human population. Public health surveillance plays a crucial role in anticipating these risks by monitoring the ecological triggers that lead to rodent population booms. Known as the trophic cascade hypothesis, researchers have observed that heavy seasonal rainfall often leads to an abundance of seeds and insects, which in turn leads to an explosion in the mouse population. Following these ecological shifts, health departments may issue seasonal advisories to warn hikers, campers, and rural homeowners of an increased risk. However, significant limits of knowledge remain. There is currently no commercially available vaccine for the hantaviruses found in North America, and there is no specific antiviral drug that has been proven to cure the infection once the pulmonary phase has begun. The scientific community continues to investigate why the virus is so lethal to humans while remaining asymptomatic in its rodent hosts, a biological mystery that holds the key to potential future treatments. The ethical responsibility of public health reporting in this context is to provide a balanced perspective that encourages vigilance without inciting unnecessary alarm. While the 38% mortality rate is a sobering reality, it is important to remember that hantavirus remains a rare disease, with typically fewer than 30 to 50 cases reported annually across the United States. The goal of providing this information is to empower individuals to recognize the specific environmental contexts that carry risk, such as cleaning a long-closed garage or opening a seasonal cabin, and to act with informed caution.